because largely of the way the newspapers report what it is we do, they think that we are evil. And they think that our job is to deny people treatment. And this just gives you an example of some of the media coverage and of some of the people that sometimes we have to walk past in order to get into the office. Because people protest against our decisions. And we sit at the moment between the government and the pharmaceutical industry in terms of whether we say, yes, a drug, for example, can be prescribed by the NHS, or no, it can't. And so it is always us in the middle that gets the protests. And that's okay, that's fine. Our shoulders are broad and we can take it. But there is a very, very negative attitude about the organisation, primarily in the press. And so one of the challenges we face as in our programme is to try and cut through people's perceptions about what it is we do compared with what we actually do. And we often find that when people actually start to work with us, they're really surprised and they're very pleased about what it is we do, but the assumption from most members of the general public is that we are a rationing body and we are the people who say no to drugs that would otherwise save someone's life. We're doing an interesting piece of work coming up that's going to be looking entirely at patients' experiences of care. And we will be producing some guidance and some measurable quality standards on the patients' experiences, both in generic interactions with healthcare professionals and particularly around patients' experiences of mental health care. And we will be looking at these key areas of communication, information, shared decision-making, dignity, partnership working between patients and clinicians, and rights and responsibilities of both health professionals and patients. So I just wanted to finish up with some thoughts about the future, because things are going to change. The change in government, I've said, may mean different or new roles for NICE, almost certainly means different or new roles for NICE. And therefore, there are potentially implications for how we involve patients. All of the rhetoric from the government is no decision about me without me being the patient. So they talk about patient-centred healthcare as being their ambition. And so potentially patient involvement will have a much higher profile in the future in the UK. The biggest change at NICE is that we are now being asked to produce quality standards, which they're going to be a significant part of our future work. We have to produce 150 of them in the next 4 years. And these are benchmarks of quality that organisations should be aspiring to achieve. And they cover 3 key aspects: clinical effectiveness, safety of patients, and patients' experiences. The other really big change is that we will also be asked to look at social care, so care provided by social workers, which is currently the responsibility of local authorities and not the NHS, alongside medical care. So that hugely expands our remit. It expands the stakeholder community with which we have to work, and potentially changes who the individuals are who sit on our groups. And another really big change is that from 2014, we will no longer be part of the NHS. We will no longer be part of the health service. We will be part of the civil service. So what are the implications of that for patient involvement? At the moment, people see the NHS logo and they understand who we are and where we come from. If we are not the NHS, then there may well be difficulties in getting people to engage with us. If you want to know more about what we do, this is our section of the NICE website, putting patients in public at the heart of NICE's work. There's more information on that page, and we also have a collection of all our patient versions of our guidance on that website there. And please do contact us if you want more information. Muchas gracias. for translation? Yes, I do. I do. For the questions.
Pueden empezar el turno de preguntas cuando lo deseen.
Where are you? Up. Ah. Okay. Okay.
Victoria, antes has comentado que trabajas con un grupo, con un equipo pequeño. A mí me gustaría saber cuánta gente integra tu equipo de trabajo.
We have 9.5 people. We have one person who works part-time. So 10 staff members, but 9.5 whole-time equivalents. And we're an organisation of around 400 people, so we're a small team compared to other parts of NICE.
Hello, congratulations for your presentation. You talk about working with subgroups that have problems to say about their experience. How do you manage with this kind of people? You just use proxies or do another procedure to manage to get that experience from those people that cannot express what they are feeling?
It's a difficult issue. We try not to use proxies because we feel very strongly that that you get a biased sense of what the real issues are. So we try and work very closely with organisations who work on an everyday basis with those particular groups, say children or people with learning disabilities, and we use mechanisms such as focus groups or interviews or conferences to make sure that we have at least a snapshot of people's experiences that we can feed into the group, because the nature of the groups means that not everybody with an interest can be around the table, and we have some particular issues. We've just developed a piece of guidance on motor neurone disease, and it was very difficult to get some of the very, very severely ill people who have very particular communication difficulties. But we encouraged a lot of people who were interested in the topic but couldn't be part of the group to participate virtually, so that they would read all the papers and they would submit comments in between meetings but wouldn't actually attend the meetings. So what we try and do is have a variety of options depending on the topic and depending on the subgroups of people who aren't available. I hope that's okay.
Gracias. Es una pregunta muy práctica. Quería preguntarle de qué manera se resuelve la participación de los ciudadanos en estos trabajos. Me explico. En general, bueno, pues todos tenemos que trabajar para vivir, ¿verdad? Entonces, ¿cómo se regula en la práctica esa participación? Es decir, el sistema legislativo, el sistema laboral, contempla la opción de tener permiso oficial o legal, o no sé, cobertura legal para poder participar en este ámbito.
Sorry for the delay. The simple answer is there's no legislation. And so we are very reliant on people's goodwill. But it's one of the reasons that we think it's very important that we offer people payments to be able to come to meetings, because we acknowledge that for some people they are having to take their holidays to come to a meeting, or they are having to close a particular bit of their service in order to come to the meeting. But there is nothing legislative that says they have a right to this kind of work. So we have to identify other incentives, for want of a better word, that allow people to take time out of their lives in order to take part in these groups. As I think I indicated in my presentation, a lot of health professionals are allowed to be on these groups because it's considered professional development. And so their organisations are very happy for them to be part of the group, and it doesn't cost them financially. But we're very aware that for a lot of people, the only way they can do this is by us offering them money, and also offering them money for things like childcare, or for a carer's allowance as well, so that any support they need additionally is catered for as well.
Thank you very much, Victoria, for being here in Madrid. Thank you very much
indeed. Thank you so much.